Yeah, so welcome to each of you. So grateful you came out tonight and spend some time with us as we do a little dry eye webinar. This is Dry Eye Awareness Month, and so part of our goal of doing dry eye awareness is, let me update this here just a second. There we go. Okay, so we thought as a way to increase dry eye awareness, to give a review of dry eye causes, treatments, options available, things that are current and things that are coming down over the next year or so, and also good patient tips, which might be helpful. Turns out that not only is this Dry Eye Awareness Month, but I looked at the day today. Today is National Eat Your Jello Day. So Eat Your Jello Day. It's also National Simplicity Day. So I thought that's appropriate, that our goal tonight is to try and make this topic as simple as we can and as relevant as we can, so that we can learn together and take from what we can to help our eyes feel better and help with the dryness. I'm joined tonight with Dr. Michael Befrus, who's with us as well, and Dr. Brar. Dr. Brar just completed her ocular disease residency with our clinic, and we're lucky to keep her on board. She stayed on board with us, and she's also one of our staff providers now. And then Leslie, who could make tonight with a birthday party for her niece. We're excited to have Aldana with us tonight. So this is our dry eye team, and I really feel like, in my mind, it takes a team to help out with this condition as we approach it from different perspectives and different causes to work together. So I'm grateful for this good team. It's nice to be able to work with each one of them, and I've learned a lot from them. Hopefully, as you're in the dry clinic, you'll be able to see them as well and work with them also. There's, as far as dry eye goes, it's interesting. There's over 33 million Americans who have dry eyes, and maybe half of those are diagnosed. So there's a large percentage of patients who don't have that official diagnosis, and as a result, may not be on appropriate treatment. What I thought I'd do tonight is just talk a little bit about some symptoms patients have, and then things that we look at as providers and as a team that can help with that. So I'll start with some of the symptoms that many of you know about. Let's see here, there we go. Our dry eye symptoms. And I see some questions coming in. That's perfect. Let's keep them coming. And then as we get to some point where we could talk about them, we'll definitely answer those questions for sure. So if you have questions as we go, feel free to type them in. I thought we could give you an overview first, and then that might help answer some of your questions and give you some context for the answers we have. Many times patients will have a variety of dry eye symptoms. Sometimes they have symptoms of fluctuating vision. So might not necessarily feel dry, but they feel like their vision fluctuates, meaning they have to keep blinking to get it clear. Or it's clear at first, and the longer they start reading or watching TV, it gets blurry. So they might have fluctuating vision. That's due to tear film instability causing vision instability. Sometimes they might have symptoms of their eyes feeling burning and tired, more toward the day, for example. Many times also goes with it symptoms of grittiness and graininess with the dryness. And interestingly, strangely, sometimes their eyes can get so dry from the burning and the gritty and grayness that then they water as a reflex. So they might talk about water eyes. All of these symptoms, just to name a few, are associated with dry eyes. And so our goal is to try to find which conditions can be causing this and try to treat it for you. There's a graph that I wanted to show you, and there's a lot here. I just want to take a moment to talk about, though. It shows the different causes of dry eyes. And we'll talk about some brief causes tonight, but if we kind of start at the top here and work our way around, there's different autoimmune conditions. So maybe arthritis, for example, or lupus, different autoimmune conditions. Hormonal imbalance, so menopause can be a common culprit for dry eyes. There's systemic conditions that can cause it, and not more importantly, also the treatments for those conditions. So let's say a patient has high blood pressure, they might be on blood pressure pills, which can make their eyes dry, for example. Hereditary diseases, nerve damage. This nerve damage can be a common challenge as well. Maybe the patient has had LASIK in the past, or they've been taking, and that damaged their nerves, or they've been taking glaucoma drops for a long time. That causes nerve damage to it as well. Other causes can be a stroke, or just chronic dryness can cause that nerve damage as well. We're learning that our health makes a difference, what we eat. So gut dysbiosis, making sure we eat healthy, less processed foods, fruits and vegetables, nuts, those are helpful. And then also the environment is a big factor as well. And I'll show you some slides for that. Our behavior and habits, meaning what are our visual demands? Are we doing a lot of computer work in the daytime? Maybe not blink as much. Those can cause as well. Eye accessories, from makeup to different products like that, and eye surgeries can all cause dryness. And then what happens is it causes, depending on the cause, different types of tear film instability issues here. So they say that dry eyes is a multifactorial condition. I mean, there's multiple factors, as you can see here, that can be a factor that can cause a patient's eyes to be dry. And unfortunately, sometimes patients have several factors going on. Maybe it's their overall autoimmune condition, they've had nerve damage, their environment is such where it's really smoky, and they do work on the computer a lot. So unfortunately, several factors can combine to cause the dry symptoms that we described over here. So it's a big slide, busy slide, a lot of things on there, but it kind of gives us an overview of what we try to do as a dry team. When you come in, we try to figure out what in your world, in your setting, could be causing your dryness. And we kind of go around this circle here to figure out in our mind and with your history, what could be causing it. From the dry eye workshop, this is a group of dry eye experts that got together, and they said that it is challenging to manage dry eyes because it's a multifactorial etiology. So many factors can cause the dryness. And the goal is to determine these different major causative factors. Which of these factors could be relevant to you? And so it takes some time to figure out those different factors and to address them if we can. In general, though, I'll tell you there's a few things that can cause it that we look at. Is there decreased blinking, maybe an exposure component? How about what's the tear quality? Or the tear quantity? How's the surface health? All those factors can cause a decreased comfort of vision, quality of life. We're just going to take a few moments and go through each of these different topics. If a patient mentions that when they come in, their eyes feel most dry in the morning time, that's a clue for us as a team that they're probably, their eyes may not be closing all the way. As a result, if they're open up some, they dry out some, and then when they wake up, their eyes are really dry. You notice this, what we call staining pattern up here looks nice and smooth in both eyes. But as we go further down, there's all these little green spots, and this is what we call staining. The staining is greatest inferiorly. This is more due to exposure, where the patient may not be closing their eyes all the way when they're sleeping, and or many times associated with it, in the daytime, they may not be blinking their eyes all the way in the daytime. So an exposure component can cause this dryness as well. They might have the best tear quality and tear quantity, but if the eyelids don't close all the way or they're not protected, that can cause dryness as well. And sometimes it's more than just the closure, but maybe it's due to their eyelid positioning. So we check the eyelid positioning, making sure the eyelids are rolled in. These, unfortunately, are rolled out. That can be due to aging changes. And as a result, they don't close all the way, leading to this dryness. For some patients like this who have good tear quality otherwise, good gland production, we can put a contact lens on like we did here, and it heals it up. It protects it until we can get in to do the eyelid surgery to help us so they close better. So exposure makes a difference. One thing we talk about is making sure we blink regularly. Another challenge is our environment. And if we kind of think about our own sphere and kind of work outward, look at all these different factors that can make our eyes dry, from different gases or aerosols. Maybe work in a salon, air conditioning. When it's really hot, the air is blowing our eyes. When it's really cold, the heater's blowing on our eyes. Humidity levels, different allergens. That's indoors. And then we go outdoors, and there's different fumes and allergens as well, different gases. And then there's the climate as well. You can be doing great with your dry eyes and feeling pretty good. And then maybe you take a trip to the Southwest where it's really hot and dry, and there's low humidity or high wind or high altitude. And that can cause the dryness as well. So we look at the ocular surface, there's all these little micro areas around us in our home, but outdoors and in different climate settings that can make our eyes dry. Many of you remember this about a week or two ago, the smoky environment we had. And we had, unfortunately, a lot of patients, they were doing pretty well with their dry eyes, but that low grade constant smoke for a few days was an outdoor pollutant that cause your eyes to be dry. So it's a challenge when we see things like that. You can be doing well with dry eyes or working pretty well, and then things like this can pop up, unfortunately. So we try to be proactive, figure out which things can cause it, what in our world, in our environment, could be causing those changes there. Another thing that can cause that dryness is something we learned from COVID, what's called mask-associated dry eye, so MADE, M-A-D-E, mask-associated dry eye. And the masks, unfortunately, had an ocular effect. A lot of it was because of this warm air blown up towards our eyes with this bacteria on our eyelids, higher concentration of that, increased humidity, and or decreased humidity with that, warmer temperatures made our eyes really dry. Add to that during COVID, for example, a lot of us were doing more screen time, and so we weren't blinking as much. Add to that stress, and those are factors that led to a poor environment, which made our eyes really dry as well. So when you wear your mask, making sure it's blocked appropriately there, so air doesn't get up there and cause your eyes to be more dry. It causes mask-associated dry eyes. Here's some tips we're finding for patients. Aldana, you want to tell us about some of these tips here? If you're still there?
Sure. Yes, I'm here. Okay. I was able to unmute myself.
Good.
Yeah, so in the first picture, we're seeing a portable humidifier. Interestingly, we actually learned that tip from one of our patients who came to the clinic, very severe dry eye, environmentally induced. The patient drives a lot for work. And she showed us this little portable humidifier looking like a coffee cup.
Yeah.
You can put in your cup holder in your car. Those are pretty inexpensive. You can find them online. And what they do, basically, they increase the humidity in the air. So it helps. It's another little thing that we may add to our environment or our daily routine, what may just help us to battle the dry eye. And to the right, we have a picture of a moisture chamber goggles. Those are maybe not the most flattering looking.
I'd wear them, Aldana.
Yeah. Well, they help because what they do, as you can see, they have a little bit of like a cushion or a silicone pad to block the air, especially when we're outdoors and we're exposed to all of these environmental factors, what Dr. Lifferth just mentioned. And that's another good idea to block that air. And again, we have a few patients who wear those. And we can also do prescription power lenses in those moisture chamber goggles. So of course, a patient can wear them pretty much all day long, including bifocal powers. And they do serve as that environmental protection as well.
That's perfect. Thanks, Aldana. That's a great summary. We don't have any property or investment connection with these products there, but they're found online, and Donna's been finding some good things that can help the patients, simple things like that. So if you travel a lot, take this portable humidifier. We have a lot of patients who say they're fine, except when they go outside to play tennis or when they're playing golf and it's really windy, or when they're going cycling, that they can find some sort of glasses with a seal around them that protects it. So this is taking our own environment and protecting it, creating our own microenvironment. Perfect. Thanks, Aldana. So that's a way we can help protect the exposure, making sure there's no dryness from that. Another thing that can cause our eyes to feel dry is low tier quality. So there's quantity and quality. Low tier quality can come from one source, can just be eyelash debris buildup. And the eyelashes are doing their job. They're trying to keep debris out of our eyes, but sometimes they build up. And when they build up, they mat up. And as a result, it can create this biofilm along our eyelids, which clogs the glands that we need. And when the glands are clogged, they don't produce oils like they could or like they should there. Even leads to styes commonly as well, but more commonly, just the dryness like that. So if there's a lot of debris buildup, that can cause dryness. And it can be common with makeup and or eyelash extensions. And so we tried doing in the office, we tried to clean them off initially, maybe the microscope in our exam room there, I was able to get some of that off there. But really the best way is to do a good cleaning in the office. This would be kind of like you go to the dentist and get a good cleaning along your eyelids, along your teeth. This will be on your eyelids. So we clean the top eyelids, we clean the bottom eyelids, and then the result is nice, clean, clear lashes. So sometimes if there's significant debris buildup, a good in-office cleaning takes care of that. We've also found following it with a blue light therapy helps sanitize it. So it kills all the bacteria that goes along with debris buildup. So that's something we may recommend for you as well. Once it's clean though, if we can keep it clean and do home therapy, which we'll talk about in the office for you as well, to keep it clean, that helps prevent that buildup as well. Helps, once it's clean, it's easier to keep it clean. And when it's clean, it just works better. What's new coming out regarding this area? Well, there's a new medicine out. It's called Tarsus. It's TP-03. It'll be out, I think, from what I've heard, September or October time, but it's targeted specifically to kill this Demodex. So there's these little microbial buildup along our eyelids. It loves the lashes, and it causes this buildup, this kind of oily, greasy buildup along the lashes. In addition to cleaning it, this kills it. So that's a good way to keep the lashes clean, and we're excited to have that product out hopefully the next couple months. We talked briefly about eyelid eye accessories, and we're learning that makeup can make a big difference as well. Unfortunately, with dry eyes, women are more prone to dry eyes than men, generally speaking. Maybe it's a hormonal factor for whatever reason, but also women are ones that use makeup, generally speaking, as well. And so we're finding there's different makeups that can cause more irritation, more blockage, less tear production. I'm going to turn this over to the pros in makeup, Dr. Brar or Aldana. Anything you want to say about makeup? Specifically the 2020 line that we found that to be helpful for patients.
Oh, absolutely. Since I'm the expert here and
More so than I am, Dr. Brar.
so yeah, absolutely. In our experience, we have found that a lot of makeup lines actually do have a lot of inflammatory ingredients. And we find that, just making sure you're taking your makeup off every night, it's an easy thing to maybe miss or not, get rid of all the makeup residue off our eyelids. It's really important because a lot of these makeup lines, at various stores, they have a lot of those inflammatory ingredients. So this 2020 beauty line was actually made by a female ophthalmologist. It was tested and approved, and she made this line, which is very clean. It doesn't contain any of those, inflammatory ingredients like prostaglandins, other chemicals which can be harmful to our lashes, but also our eyelids. Imagine just having that inflammation just sitting there over the course of the day, and then possibly, if we don't remove it during the night, it's just sitting there and creating that inflammatory barrier, which leads to, some of this dry eye as well. So definitely this, brand is great because it works really well. We've had, great success with it with patients and throughout our clinic. I really like it, so I would recommend it.
Thank you, Dr. Brar. I said it much better than I could have said it, and you have personal experience too, so perfect. That's great. So they do sell this in the office. There's different chemicals that can cause problems with dry eyes, and this is one that's safe to use, and we can give you information about that too if you're interested.
Absolutely. And sorry, just Dr. Lifferth, another thing I wanted to add was a lot of patients, do ask for lash and brow boosting serums. A lot of the boosting serums out on the market, like Latisse, they have, it's basically a prostaglandin, and it's, producing that inflammatory response along the eyelids, and that can actually lead to more gland disease, which is a subtype of dry eye. So this lash and brow serum, is cleaner. It's made up of natural oils, so it's much safer and healthier for your eyes compared to other, boosting serums that might be out on the market. Just wanted to add that as well, since that's quite a popular product.
Yeah, and it works well. I'm glad you did. And we also found clinically that many times when we can reduce inflammation, clean up the lashes, we start to get healthier lashes too. So there's a nice benefit of both approaches there.
Absolutely.
Yeah, thanks, Dr. Brar. Did we miss anything, Aldana?
And no, Dr. Brewer really gave a wonderful explanation. If I may add anything just from myself and my own experience working with patients, it is very stunning how hard it is actually to remove the makeup properly. So sometimes we have a patient saying, oh yeah, I didn't wear makeup for the last few days. And then we look at them under the microscope and we are still seeing traces of mascara or some debris from makeup. So again, it just tells you how strong and adhesive and harsh those chemicals are. They can sit on the lid margin literally for days sometimes. That's why the lid hygiene is so important, removing that every night, because it just builds up over time.
That's a great point, Aldana.
Yeah,
Thank
I'm glad
you.
you mentioned that. We see that, don't we?
Yes.
Mhm.
Good. Well, thank you for, again, the update on the makeup part of it as well. And we feel like that's another way we can help improve the dry eye symptoms. The other way, the other condition that can cause dryness is not that for the tear quality, is not eyelash debris buildup or inflammation, but eyelid gland blockage. And there are 25 to 30 glands along our lower lid, along our top lid. They're called our meibomian glands. And ideally, as we push on the glands oil should come out nice and clear like olive oil. As you can see here, I got some oils that come out here, almost toothpaste-ish like, and there's not so much and some not at all. The problem with that is if we don't get the oils to come out of the glands, we don't have the quality that we need. And the oils help protect our tears. If we don't have the oils, the tears evaporate quicker. It leads to what we call evaporative dry eye. Sometimes we just can't get any oils to come out at all, as you see in that picture. So there's some good things to do for that at home and in the office. The best way to find out is how much glands you have, how many glands you have, how well they're working is through just a brief 2 or 3 minute in-office test called meibography. And we feel it's so important that all those who are attending tonight, you can get a complimentary gland scan next time you're in the office for just as a courtesy to you for attending tonight. It'd be kind of like a dentist taking a tooth x-ray, find out how the teeth look, cavities. This kind of like it is an x-ray, similar to the eyelids, helps us see how many glands you have and how well they may be working. So just remember the secret code gland scan, and you'll get a complimentary courtesy meibography. We felt like that's an important part of it. And for Dr. Brar and myself and Aldana, this is the way we kind of guides our treatment. And here's what we'll see when we do it. Ideally, here's a kind of an x-ray of those glands, as I mentioned. This is great, nice, long, fairly even glands all along the lower lids there. But as we kind of go through time, different patients start to see these glands are getting a little bit narrower or segmented, some are a little bit shorter. This one over here is missing. Again, as time goes on, different patients, we lose more glands, the glands get shorter. Where sometimes we just have small segments of glands remaining, or some not at all, like this patient. So unfortunately, if we don't have those glands, or they're completely lost, we don't get the oils like we need. And that affects the tear quality. So we try really hard to diagnose this earlier through meibography, treat the gland blockage quicker, more proactively, so they don't get too clogged, and so we lose them. If they stay clogged, then they start to get more clogged and they atrophy and we lose them. So the sooner we can detect this, the better results we have. So meibography is helpful. Here's kind of what it looks like clinically. So here's a patient with nice smooth corneal surface. We had him blink, and then about 4 or 5 seconds later, you see these little dark spots showing up. These are areas where the tears are starting to break up. It's called our tear breakup time. Ideally, the tear breakup time should be closer to 10 seconds. This patient's tear breakup time was 4 to 5 seconds. So the tears were evaporating quicker. It's simply because the glands along the eyelid are clogged. The oils aren't coming out like they could or should, and they can't protect the tear film like they need to. As a result, patients with this type of evaporative dry eye will find they have to keep blinking to get it clear, or they might be clear at first, then gets blurry the longer they do it. So this is called evaporative dry eye. It doesn't look like this video is going to play for me, but I want to show you an example. Oh, yeah, it doesn't look like it's going to play. But basically what happens when we see this dry eyes, it just all makes us sad. The patient's sad, makes us sad. We try to improve that so it's a happy face, improve the dry eye quality, so a longer prolonged tear breakup time. Tips we can do at home is many times we'll talk about a Bruder mask. That's an easy, inexpensive way to heat up the glands. If we can heat up the glands, ideally helps the oils come out easier and better. This is something you can use at home. You put it in the microwave for a few seconds and leave it over the eyelids for about 7 to 10 minutes. It stays warmer longer than a washcloth, and that's what we're hoping for. If we just do a washcloth for a few minutes, it's probably not going to heat up the glands enough or warm enough, and the oils won't come out. So we need something that stays warmer long enough, something like a Bruder mask. The other thing we found is for those patients who travel a lot, it's hard to have a microwave handy all the time. There's rechargeable ones. And you can take this with you on the go, or if you're just staying at home, it sure is a lot easier to have it next to your bedside. You can put it on or your couch. You don't have to go to the microwave. But this is helpful, also works really well. Again, we don't have any interest in these products, but you can look online for a rechargeable eye heat mask. And there's different ways you can access that, which really helps give us the results we're looking for. Any comments there, Aldana or Dr. Brar?
Yeah, I just wanted to add the electric heat masks. There are a lot of different options on Amazon. So easy to find, easy to shop for. It can be quite overwhelming which one to choose. So we are definitely happy to help and, find something in your budget range for specific, patients. So absolutely, that's something we can discuss in the exam rooms.
That's great.
Because there are a lot of options.
Yeah, I think that's great to do. And I think if you see in these pictures, these patients look really serious. There's other masks that make them look happy. So we might want to choose one of those as well.
Yeah, absolutely.
But it is helpful to do to get the glands working better. That's a good point. That's good home therapy. Many times we can also do in-office therapy. So we might do a combined procedure. It's called intense pulse light therapy. And then we follow with red light mask therapy. This is good because I'll show you some pictures later on, but basically these bursts of light, pulse of light across from corner to corner, helps reduce inflammation. And then we follow it with a red light heat mask. It's called photobiomodulation. And this mask heats up the glands, heats up the oils, so they start to come out better too. Many times we'll do this in the office, and then the patient will do the home therapy with the heat mask. Both are helpful to help those glands start working better. It's a procedure, doesn't hurt. Donna and Leslie are the ones that mainly do all these procedures. It's so helpful. Doesn't hurt, doesn't affect your vision. You can get up and go. Donna, any comments about the procedures you help us with for this one in particular?
Sure. Well, I think our patient's testimony is the best really proof that the treatment really works. It helps. The beauty of the treatment is that patients can actually self-select the treatment whenever they feel like their eyes are just flaring up, because it's kind of like an instant gratification. After the mask, the eyes just feel really, really good. The oils are all heated up, and then when we squeeze them, that really improves the tear quality. Of course, there's a carry-on therapeutic effect, but we have a lot of patients coming for the treatments monthly. Others are coming maybe quarterly or semi-annually, but we do encourage our patients to just watch their symptoms and be aware if they're anticipating, let's say, a flight, or they're going to a place where they know the dry eye may potentially flare up. That's a good way to kind of pre-treat potential flare-up and do the light therapy. And most of the patients are able to tolerate the treatment really easily, and I would imagine that some of our participants today already had the treatment, so they're probably familiar with the low-level light therapy.
Yeah, this part here. That's good. I like that's a great way to put it, Aldana, that we're trying to be proactive. So if you anticipate a trip coming up, or the weather might be drier, what can we do to help it so you can keep your eyes feeling good and while you're on the trips? Do we need to do the light therapy again, touch it up, or some more home
Yeah.
therapy, get those goggles. As proactive as we can be, the better results that we'll get.
For sure.
Yep, that's perfect. Thank you. Let me show you some pictures of patients who've had IPL and light therapy. It's nice to kind of see, Aldon talked about patients' testimony, but these are some clinical photos. This patient has had, as you can see, as I push along the eyelids, I got some oils to come out, kind of cloudy there. We've got some oils to come out there, not so much there. Hardly any oils there. A lot of inflammation. See these little red blood vessels? That's called telangiectasia or ocular rosacea. And that limits how well the glands work. We did a series of IPL, did home therapy, and now look how the oils are coming out a lot clearer, and there's less inflammation. So the less red, the oils are coming out better. This is improved tear quality that helps give us better prolonged tear breakup time. Here's another example of a patient with a lot of ocular eyelid inflammation, minimal, if any, gland expression. And then after IPL series, really great results. So oils are coming out, there's less inflammation. So these are, again, tips we can do in the office in addition to what you do at home, which helps with the dry eyes. It's nice that now we have treatments available that can help for patients like that. Even patients who have very minimal glands, like you see here, if we can do IPL regularly, that keeps the surface nice and smooth. So this is a good example of the value of home therapy combined with in-office therapy. It gives us this synergistic improvement there. And just briefly, IPL, intense pulse light therapy, and meibomian gland dysfunction. There's different benefits of it. It reduces inflammation, helps the oils become more fluid-like, helps promote tear, better cell turnover, reduces inflammation, antimicrobic, reduces inflammation there, and antioxidant effect. There's a lot of great benefits that come from that. What else is new in this area for meibomian gland dysfunction? There's a new one out called, it's Novo 3. It's actually just was approved, so hopefully the next few months we'll get it out. It treats specifically meibomian gland dysfunction with the goal of stabilizing the tears. It's a tear film stabilizer. We talked about tear breakup time. This stabilizes that. It's called Mibo. It should be coming out soon. It's been approved. We're excited to get that in the clinic as well. We feel like that's going to really help a lot of patients in addition to their home therapy and office therapy as needed. So going back to that circle of things we're looking at, so we talked about quality, tear quantity. Briefly, I'll show you a couple things here. What if patients have pretty good glands, functioning pretty well, but low tear quantity? This is what we call our tear lake. And I did want our tear lake to be nice and deep. This is really shallow. This is common in patients who might have Sjogren's or other autoimmune conditions. When we don't have a lot of tears, it's hard to draw from those and coat the surface of the eye like they should. There's things that can cause that, even cause a lot of dryness, and we try to work to heal that. Different health conditions can do that. Autoimmune conditions, even medications, as I mentioned. Many times we'll use a steroid, some type of steroid that might work best for you and for your insurance that would cover well. Like Isuvis or Flarex, Olodamax, nutritional supplements to reduce inflammation. Steroids work great. However, if we use them too much or too long, they can cause higher eye pressure. So there's other immunomodulators we can use like Cequa or Restasis or Xiidra as well, that's safer to use, as well as other types of vital tears. These are tears that come from your own body just through a blood draw or different ways to stimulate the tear production. Many times also, once the inflammation is controlled, we like to use punctal plugs. It's a great way to help keep your good tears on your eyes longer. So the plugs, let's see a picture there. It's a small plastic device. We have 2 tear ducts on the bottom, 2 on the top. We just plug out the bottom 2 generally, and that helps give us a deeper tear lake. Sometimes if it's due to low tear quantity or exposure, we can maybe just use a contact lens, and that helps it heal pretty well. Sometimes if there's a lot of surface dryness, many of you know or have even tried, unfortunately, these Procare lenses, which is an amniotic membrane. This amniotic membrane has growth factors, helps us heal perfectly, the best we've seen. So it really helps it heal once we treat the underlying causes of the dryness. So what's new in this area? Coming out soon they're looking for a partner to bring it to market, but it's called cyclosol. And basically it's stronger than Restasis, stronger than Cequa. This is 0.1% cyclosporin. Of course, their website will say it has high patient comfort and satisfaction results, high responder rates. We're excited to see how this will look. Cyclosol as another way to control inflammation. When there's inflammation on the eye, unfortunately, the tears don't work as well. We don't produce as much tears. As a result, they get more inflamed, and then that causes less tear production. So if we can stop that inflammatory cycle, that helps with that setting like that. Another thing that's coming out that's new is something to control the inflammation. Basically, there's these molecules within the body called reactive aldehyde species, or RASP. And they bind to different molecules. They affect their function. They activate these pro-inflammatory mediators. So basically, these chemicals in the body increase inflammation. Well, there's treatment or targeted treatment to create RASP inhibitors. Well, if we can turn those off, so we can reduce inflammation. Aaron. Good. Can you come let the dog out? We're watching my dad's dog, and she's right here by the door. Anyway, so this is a way we can help reduce inflammation by using some new medicine that's coming out, hopefully in the near future, hopefully by the end of the year. Good, so we talked about possible exposure, low tear quality, low tear quantity. Final one to talk about is decreased surface health. There's two main topics for this. This could be due to what we call a corneal dystrophy, where the surface of the eye just isn't smooth. It'd be kind of like, I've explained to patients, kind of like having a bumpy windshield. If you have a bumpy windshield, the windshield wipers don't go across it evenly or smoothly. And as a result, it can not feel very comfortable. It also affects the tear quality, the tear distribution. Well, imagine if the windshield is dry and do it, it's even more uncomfortable. Same thing with the eyes. If the eyes are dry, this dystrophy, these little ripples and ridges on the surface of the eye can affect the tear distribution. There's ways we can treat that with maybe an ointment at nighttime, or if we need to, a procedure in the office to smooth it out. Another thing that we're concerned about, that we're learning more about, is also what's called neurotrophic keratitis. This is a condition where the corneal nerves just aren't working as well. Instead of them working 100%, maybe they're working 50% or 10%, or not at all. It sounds strange, but sometimes when a patient says their eyes are dry and they feel scratching, gritty, burning, to us as providers, that's a good sign. That means your nerves are still functioning. What's even more concerning is if a patient has a lot of dryness on their eyes, and they don't feel it. That's concerned that there's a neurotrophic condition for it. So we're finding that if we can check the corneal sensitivity, that helps to direct our treatment, and there's treatments out there for it, some medicine that helps boost that the corneal sensitivity for it. All right, so we talked about three main things that can cause dryness, maybe exposure component, lower tier quality, lower tier quantity, and the overall surface health. All these can lead to this decreased comfort, quality of life, even vision. So when we see a patient in the dry eye clinic, these are things we look at. We look at the eyelid closure. We check for corneal sensitivity. How are the nerves working? We look at the eyelashes. Look at the eyelids. How do the glands look? We compare that with meibography. Gives us context how many glands the patient has, how well they're working, their expression. We look at the tear breakup time that's associated with that, and how quickly they evaporate, as well as the tear quantity. And then we look at the staining pattern. How does it look dry, and in what areas? Those give us clues. With our clinical exam, and with your history, your world, we try to figure out what's best for you and which phase of dry eyes are you at. And then we give you a overview, kind of a map, a journey that you're on, that we try to find out where, based on the phase, which treatments would be best for you, and then we give you a personalized home treatment plan. And this changes as the dry eyes changes. Sometimes we have to control inflammation before we do plugs, for example. And this home treatment plan might change depending on your stage of the dry eyes. but we feel like it's important to customize a treatment plan for that. So our goal is, as we work with you as a team, with providers and Aldana and Leslie and you, our goal is to improve that blinking, improve closure, improve the tear quality, improve the tear quantity, and as a result, improve the ocular surface as well. So hopefully we'll have improved ocular comfort, vision, and quality of life. So that concludes kind of the overview. This is the fun part. Now we want to hear some questions. I'm going to go and pull up some that were asked already. And as we go through here, feel free to ask more. Patient asks, what heat setting and time should you use with a heat mask? There's different products, so I guess it depends on the product you get. You usually want it for about 7 to 10 minutes. And as far as heat goes, you want it warm but not hot. So maybe put it on your wrist, and if it's comfortable on your wrist, you can put it on your eye. So I guess you'd have to see the different masks and their unique temperature settings, but you just want comfortable, you don't want to burn yourself, but at least do it for 7 to 10 minutes if you can. Any comments on that, Aldana or Dr. Brar?
I just wanted to add the 7 to 10 minutes is on the eye, not warming it up for 7 to 10 minutes. So
oh yeah, good.
Yep. We want to place the heat mask on for 7 to 10 minutes because that's where we find that those oils really start to melt and help that oil gland blockage there, that time.
Yep, that's perfect. And a lot of patients find it really relaxing. They find sometimes just put it on and just rest and keep their eyes closed. It forces us to keep our eyes closed. That helps out with tear coverage. So it depends on the setting type you get, but at least for 7 to 10 minutes. Okay. Dr. Brar, you want to take this one? Does prolonged use of eye contacts for vision cause dry eyes too?
Yeah, definitely. I wouldn't say it causes dry eye, but it can be a factor which can make dry eyes worse. The contact lens use has been shown to be related to some oil gland loss over time. And that obviously, as we've heard throughout this lecture, that can be a component of dry eye. So over time, we can see that gland loss on the scans from patients who have worn contacts for a prolonged amount of time throughout their life. And also contact lenses, secondly, can also go ahead and create some damage to the nerves on our cornea. So over time, we can have some neurotrophic effect from the contact lens use. It creates some nerve damage over time. So absolutely, contact lens use is a risk factor for dry eye. So it's definitely something we ask and look out for and watch for patients who are contact lens wearers. And definitely if you are a contact lens wearer, treating the dry eye is even more important for you, in my opinion.
I think you're right, because if our eyes are dry and we put contacts in, it might make them more dry. Yep, that's a great response, great answer, thank you. And that'd be one of the things we look for. And they've come a long ways in contacts. So if you need to wear contacts, there's ones that work better and last longer.
Mm-hmm. Yeah, we want to make sure the fitting is good. It's not a tight fit. Tight fitting contact lenses can, exacerbate dryness as well, making our tear flow not as good on the surface of the eye. So there are definitely, things we watch out for in those contact lens wearers. So definitely something we look for during exams.
Yep, that's perfect. Aldana, the next one, I'm going to plug in my computer. They ask,
Okay.
how often do you replace the Bruder mask?
I think the manufacturer's recommendation is once a year. That's according, I remember I asked Dr. Karpecki that very question. I think it's about a year, but of course, if you feel that the mask starts losing its effectiveness, it doesn't stay hot as long, that's probably a good time to go ahead and replace it. Of course, you can keep it nice and clean. You can hand wash it with just a very mild, gentle soap and water. But yeah, if it just shows signs of wear and damage, maybe doesn't hold the heat, as long as it's time to replace it. But typically it's a year.
Yeah.
Year intervals. That's according to my knowledge, at least.
I think that's a good, I think that's good. Good way to answer that. Another question, does an eyelid lift make dry eye worse? And that'd be one thing we'd be concerned about. As we talked about, a cause of dry eyes can be exposure. So sometimes the eyelid lift works too well. I mean, it opens it up, but it doesn't close during the daytime, or worse, it might not close at nighttime, causing what we call exposure keratitis. So we want to make sure that working with your surgeon that doesn't work too well, and watch for the healing and watch it carefully afterwards to make sure it doesn't dry out. So many times patients still need it so they can see and have vision, functional vision, but we want to also watch for any complications from that. Great question. These are all wonderful questions. Another question here, do cataracts contribute to dry eye syndrome? And this is a great question. They're not directly related. They can have similar symptoms. Both can have can cause blurry vision. Usually, if it's cataracts, then the vision will be blurry all the time. If it's more dry eye related, then the vision is going to fluctuate. I mean, they keep blinking, it gets clear, for example, or it might be more task specific after prolonged reading for 10 or 15 minutes. So they don't necessarily cause similar symptoms, but for different reasons. The important thing here, though, is if and when it comes time for cataract surgery, we want to make sure that the surface is nice and smooth. It's what we call optimizing the surface. If we can optimize the surface, then Dr. Beffers gets better results, gets better measurements for cataract surgery, and better measurements gives you better results. So if and when it comes time for cataract surgery, we definitely make sure the surface is nice and smooth. Yeah, good. Dr. Barr, would you mind taking this one? What eye surgeries can be risk factors for dry eyes?
Yes, absolutely. So like we discussed, an eyelid lift can be a risk factor. Having LASIK or other refractive surgeries can also be a risk factor because we're going in to, create that surface corneal change to get you your prescription corrected. And that can damage some nerves in the cornea. Cataract surgery can also, be a risk factor to some extent. Like Dr. Lifferth mentioned, we want to optimize the surface. Post-operatively, patients can experience some dry eye. So we definitely want to watch for that. Medications that we have to use post-operatively can also contribute to some dry eye. So there are, a variety of eye surgeries, but those are the main ones that come to my mind, Dr. Lifferth, that we come across.
Yeah, I think also we can add to that glaucoma surgeries can do it, glaucoma drops, unfortunately.
Oh, absolutely. Yep. Yes, definitely.
And then I had a question about calling the office for an eyelid cleaning. You can certainly call and do that anytime. We're happy to do like a pre-evaluation if that's helpful for you to see where you're at and to see what other things might be helpful for you. Then I want to go back to a couple of things here. Let's see here. These are great questions. And as I pull this up, what other questions do you have? As I mentioned before, we want to make sure that all those who attend are familiar with this code, gland scan. You can just let Aldana know, and we can arrange that for you for a courtesy mybography. And then also, we wanted to, for those who are attending, a raffle of 3 people to do this red light mask therapy to go along with that. So I'm just going to choose some numbers here based on the order of my screen. And I have Sylvia McTire, and then Jean Frudenhall, and then Kathy Thomas. So Kathy Thomas, Jean Frudenhall, and Sylvia McTire. If you want to let Aldana know that you guys, Aldana, if you could write those names down, you can have.
I will write it down. That's the first.
That courtesy red light mask therapy to go along with your home therapy. We're finding that's a great way to help boost the glands, reduce inflammation, help those come out better. It's a small thank you to each of you for attending tonight. This is great. So another question came up for insurance coverage. The evaluation And a lot of the testing, the photos that we take, all covered by insurance. A lot of the medicines can be covered by insurance. It depends on the insurance. Some are covered great, some are not. Our team does a really great job trying to find the medicine that works for you that's covered by insurance. Many of the eyelid procedures, the cleaning, the IPL or red mask therapy, it works really well. It's just not covered by insurance yet. So unfortunately, that's out of pocket. The IPL and red light mask therapy combined is $300. Just a red light mask therapy is $100. The cleaning and the sanitation of the blue light is, we do $150. So unfortunately, it's not covered by insurance, but we're finding if the setting works for you, the right schedule, it's a great way to get the glands working better, reduce inflammation, help with the dryness. Here's another question. Dr. Barber, maybe if you want to take this one, when using the supplement Hydro Eye, the serving size is 4 soft gels. Should those be taken all at the same time, or 2 in the morning and 2 in the evening?
Yeah, absolutely. I usually recommend 2 in the morning and 2 in the evening, just for better absorption throughout the day and meals. So definitely taking 2 with breakfast in the morning, 2 in the evening after dinner. That helps with absorption, making sure you're absorbing all of those good supplements from those Hydro Eye soft gels. And that's what I usually recommend. I don't know if you do anything different, Dr. Lifferth. Taking 4 at the same time seems like a bit much to me.
I like the idea. If you can space them out, that seems better too. That seems more reasonable.
Yeah.
That's a great way to do it. And I think that goes along with something we mentioned earlier, is just the overall health. So it's what we call gut dysbiosis, but making sure we eat healthy, and we mentioned briefly, less processed foods, healthy foods, ocean fish a couple of times a week, drinking plenty of water. If we can't do those things, there are nutritional supplements available, like Hydro Eye. And that helps reduce inflammation. It's good for the body and for the eyes. Yep. We're trying to figure out in this area which factors of the many multiple factors that can cause dry eye are relevant to you, and how can we treat them. If it's nutrition, that can make a big difference. Great. Well, I think we got all the questions.
Those are great questions.
Yeah, I know. I'm impressed. Dr. Brar and Adana and myself, we always learn so much from you as patients, and tips you've found and things you've noticed. So we appreciate the questions, and it helps us try to be better as we work with you in the clinical setting.
Yes. I think maybe as just a word of kind of reminder, dry eye is not a curable condition, unfortunately. Still, it's a chronic condition, just like any other inflammatory or autoimmune conditions. It's about management. It's not about curing it completely. And I think keeping that in mind is very important for both parties, for us as providers and for our patients, because otherwise the expectations are going to be there, and the patient is doing all these good things and feeling like I'm getting nowhere, I'm not getting better, or I'm still getting flare-ups. Well, because you may be doing everything right, and then again, environment changes, or you have inflammatory flare-up in your body systemically, or you're taking a new medication. All of these factors matter. So with dry eye, it's just good to keep that in mind. It's manageable. It definitely is manageable with everything we talked about today. These are wonderful, excellent ways to manage this condition. However, it will never go away. It will never be to the point that I don't have dry eye anymore, because it's chronic.
Yeah, I think that's a good point, Aldana. And we're lucky to have someone like Aldana on our team, because she understands what we're looking at, but she's also very patient and encouraging. So she's educational, but encouraging. And even though this is a chronic condition, we're here to help you along the way and figure out what works best, and really try to support you on your own personal journey for that. So I think that's a good way to look at Aldana, that we can't cure, but we can treat it as much as we can.
For sure, yes.
Yeah. Good. Well, Aldana and then Dr. Brar, any closing comments or thoughts?
I think that was a great overview of, dry eye etiologies, of different factors, because it really is very multifactorial, and every patient is so unique. So just trying to, in our initial evaluations, figure out what main concern is. Time of day makes a difference. Like, when is your symptoms more noticeable compared to other times? Trying to figure out your systemic health, your previous ocular history, systemic history. There are so many factors. So it's definitely, great that we have all these tools to go ahead and diagnose and treat dry eye now. And I just wanted to add, with the myography scan, it's always amazing how much we can sometimes underappreciate how much gland loss there truly is without, having that scan on hand. Just looking under the microscope really gives us, a little bit of information. However, it doesn't give us the full picture. So that gland scan is truly important to us to really, assess the level of gland loss and level of severity of the disease that you have. So all of those things go together, and it's really helpful to get the full picture and go ahead and manage and treat the condition. But thank you, Dr. Lifferth. That was a great overview.
Yes, I agree. Thank you. Thank you so much. And I personally feel just so happy and so privileged to work with both of you, Dr. Lifferth and Dr. Barr. So to work with our patients, I think we have amazing patients at our clinic. So I want to extend that thank you to our listeners today, our participants, because I think without our patients and their patients,
yeah, we have patients, don't we?
Yes, it just wouldn't be, so worthwhile and so enjoyable to really do this. So thank you.
Thank you.
Yes, it's definitely rewarding.
Yeah. Aldana and Dr. Barr, thanks for joining in tonight. I really appreciate it. And thank you to each of our participants and listeners. If you have any other questions, feel free to reach out, call our office. We're always happy to answer additional questions as you think of them. And if we can help out with any dry eyes, we're happy to do that as well. That's something we're focused on, and I want to be there to help you all along and during your journey. So thank you so much for joining today. Have a happy Eat Jello Day and Simplicity Day and July Dry Awareness Month.
All right.
Thank you everyone for joining.
Thank you, everyone.
Thank you. Have a great night.
Thank you. You too.